What are the stages of liver cirrhosis explained? Imagine your liver as a hardworking organ that keeps your body clean and balanced. When it faces long-term damage from conditions like hepatitis or fatty liver disease, it can develop scars that slowly take over. This process is called cirrhosis, and understanding its stages helps us see how liver health changes over time. The progression of cirrhosis can be seen under a microscope through fibrosis stages. These stages are numbered from 0 to 4. At stage 0, there is no scarring at all. When fibrosis begins, it shows up as mild portal fibrosis without any septa, which is called stage 1. As damage continues, periportal fibrosis develops with a few fibrous bands, known as stage 2. Moving further, bridging fibrosis occurs in stage 3, where fibrous bands connect different parts of the liver, creating a network of scar tissue. When the scarring becomes extensive and the liver tissue starts to form nodules, this is called cirrhosis, or stage 4. This stage indicates significant and widespread scarring that affects liver function. Clinically, cirrhosis is often divided into two main phases based on how well the liver still works and what symptoms appear. The first is called compensated cirrhosis. Here, even though the liver is heavily scarred, it can still do most of its jobs. People may not notice any symptoms or might have mild signs like fatigue. They usually do not have serious complications such as fluid buildup in the abdomen, bleeding from enlarged veins, or mental confusion. Because the liver still functions well, the outlook can be quite good, with many people living more than 10 years after diagnosis. The second phase is decompensated cirrhosis. In this stage, the liver's ability to perform its functions declines sharply. Symptoms and complications become more serious. Patients may develop fluid in the abdomen called ascites, yellowing of the skin and eyes known as jaundice, bleeding from enlarged veins in the esophagus or stomach, and confusion or even coma caused by brain dysfunction. The risk of death increases significantly without treatment, and survival may be limited to a few years. This stage reflects severe liver damage that often cannot be fully reversed. To better understand prognosis, doctors use scoring systems. The Child-Pugh score looks at lab tests and clinical signs to classify cirrhosis into categories from A to C. Category A indicates well-preserved liver function, while C shows severe impairment. The MELD score uses specific blood values to estimate the risk of death in the short term and helps prioritize patients for liver transplants. These tools help doctors decide on the best treatment plan and give patients a clearer picture of their health. Before cirrhosis develops, the liver may go through earlier stages like fatty liver or steatohepatitis. These conditions involve fat buildup and inflammation, which can sometimes be reversed with lifestyle changes. If left untreated, they may progress to fibrosis and eventually cirrhosis. In summary, liver cirrhosis begins with mild scarring and can progress through stages of increasing damage. It moves from early fibrosis to full-blown cirrhosis, which can be either compensated or decompensated. Recognizing these stages helps in managing liver health and understanding the increased risk of liver cancer. Always remember, if you have concerns about your liver, consult a healthcare professional for personalized advice and care.